Hello everyone. Today we are talking about osteoarthritis. It is a very common problem in older men and women because they usually present with a knee pain. So it is a degenerative joint disease that occurs due to older age and degeneration of the tissues. It is multifactorial. It is due to it occurs due to wear and tear of the joints as one ages. And the common types are primary osteoarthritis, secondary osteoarthritis. Primary occurs de novo in the weight bearing joint like hip and knee in the older age, and secondary osteoarthritis occur due to underlying primary disease of the joint. So the signs with which the clinical feature with which the patient presents is pain, swelling, crepitus, stiffness, or maybe capsular contracture, spasm, unstable joint, locking of the joint, which occurs later on, but the primary symptom is pain, and the later on it can develop swelling as well. And the pain is usually dull and occur on activity initially, but it usually get cramp like, and coarse crepitus is also present. So basically we are now studying the pathology of the osteoarthritis, or it is a degeneration of the articular cartilage. So when the articular cartilage is destroyed, so due to the grinding mechanism, with further rubbing, the subchondral bone become hard and glossy, and the bone at the margin of the joint hypertrophies to form a spur, which is called as osteophyte. So there is, as we can see, there is thinning and space narrowing, and the bone spurs, sclerosis, and decreased joint space. So this is basically osteoarthritis, and this also leads to the deformity as well. Often one compartment of the joint is affected more than the other. So in the knee joint we see medial compartment is affected more, so leading to a varus deformity, as we see that these legs are bowed. So varus deformity is seen in osteoarthritis. And talking upon next which other joints are affected, so these are cervical spine, elbow joint, hand fingers, ankle joint, hip joint, knee joint, and foot. As we see the palpable nodules in the DIP and PIP, so the PIP nodules are called as Bouchard's nodes, and distal interphalangeal nodes are called as Heberton nodes. X-ray show the involvement of PIP and DIP joints. This radiograph shows in black arrows the subchondral sclerosis or cyst, and in blue arrows the narrowing of the joint space, and in yellow arrow the osteophyte, that is the spur. In next diagram we see the central or subchondral erosions which give rise to seagull wing sign. So concluding that, we see that the signs and symptoms are like knee pain, PIP, DIP involvement, various other joint involvement. Coming to the treatment, we use diclofenac gel, methyl salicylate gel, tablet diclofenac for 7 days after food, or ibuprofen, Nimulid, indomethacin with Gelusil. Gelusil is anti-acid. It is given 3 times. Then for severe acute cases we can give diclofenac injection, tablet Visolon, prednisolone. It is 5 mg TDS for 5 days. Then we can also give shortwave diathermy for 5 to 10 days. If there is localized tender spot, then refer to orthopedic surgeon for local hydrocortisone injection. So in this steroid is given in the knee joint. Then comes the maintenance therapy. We give tablet Voveron SR 1 daily. It is an NSAID. And then we give tablet Rabiprazole. And then for walking we can use stick to avoid the load on weight bearing joints. Then we can also perform the quadriceps exercises, in which we raise one leg while sitting on the chair, and this is to be repeated 2 to 3 times a day. Kneecap can also be used for supporting the joint in patient of osteoarthritis. So take care of your knees And that is it for today. Thank you so much for listening.